Well, I grew up in a medical family with my father being a physician, and it was something I always had an interest. And then when I grew up and really thought about what I wanted to do for a career, I really wanted to do something that had human contact and build relationships and help people, and medicine just was kind of that natural fit for me. So as a physician assistant, we're considered one of like an advanced practice provider. The old term used to be mid-level, and that was kind of a connotation that a lot of people didn't like because we're this middle ground person. But we are above a nurse, below a physician, and work in conjunction with a physician. We can diagnose, treat, and prescribe just as a physician. We can't do surgeries on our own. And a physician has to be within a phone call away within the state of Ohio to be able to practice on our own, even in the office. So we have a lot of autonomy that way, and we can practice to a very high level. But we always have that physician overseeing us, and the physician has to agree to be responsible for us. So how we do it in our practice is we have 2 PAs, 2 physicians. One's normally in surgery with one of the physicians, the other one's normally in the office, and then we're always in constant communication. So if we have a question, we just call and ask, and both of our physicians are very open and willing to answer any questions if we're not sure. So we really want to give our patients more access. So when the other PA is assisting in surgery, we have the opportunity to have another PA in the office. And with having that PA in the office, we almost always have a provider in the office unless someone's out of town on a conference or vacation of some sort. There's normally one provider in the office at all times. So it provides this amazing access point for our patients. What we take care of is very specialized. There's not many people in the area that take care of it. And that's why having more access points is very important, because wait times can be a lot. It's not something that a lot of even general gynecologists are comfortable treating past the basics. So it's a totally different type of specialty than most people are aware, and a lot of patients don't even know it exists. So it's urogynecology, so urology, gynecology. So I always say it's like women's urology and pelvic floor health. So it's kind of just teaching those patients all about their pelvic floor and what can happen and how things can loosen. And it's a long conversation a lot of times. Our new patient appointments can be up to 45 minutes, an hour long, because patients don't realize that there's a lot that goes into pelvic floor health, urinary incontinence, and prolapse. And I actually worked in family practice for 2 years prior to coming and working in women's health. It was the opportunity that was available at the time, and I really did like it, and I liked having the relationships and the continuity of care with my patients. In that practice, I did mostly women's health because no one else really wanted to do it in the practice, but I loved it. I mean, I fell in love with it at that point, but I really, about 2 years in, realized I missed the procedural part of what the more hands-on stuff that I was trained to do as well. What's unique to us specifically is that we really try to bring a lot of access points for our patients. We have offices all the way up in Troy, Ohio, all the way down to Middletown, Heber Heights, Inglewood, kind of east, west, north, south, and that allows us to be in multiple locations at different times, and then having the 2 doctors and the 2 PAs and allowing, like, I'll be in one location, our other PA will be in another location. We've been able to reach a lot of different areas that way, which I think makes us a little bit more unique. We do have a very specialized, kind of sensitive area that we work with. Most women don't want to come in and talk about urinary incontinence and bladder prolapse, and so allowing kind of a more convenient location for them within 10-20 minutes to their house so that they have more easy access to get into us. So getting the patient kind of involved in understanding the expectations, that it's a stepwise process a lot of the times. It's different in that aspect, and we really pride ourselves on like letting our patients help be a part of their care. So we give patients, treatment options from doing nothing to surgery, multiple different types of surgery options, really go over the pros and cons of both, and then the patient decides. A lot of these things are not life-threatening, okay? So the patient can do nothing if they choose, but if it's really interfering with their life, then, we can go all the way up into surgery and talk about different surgery options. And those patients, once you get the patient involved in their care like that, they're very thankful that they feel like they were a part of that care. So that's a little bit different than how we treat patients.